Prolapse is basically when the pelvic organs start to fall out of the vaginal opening, and it can be one or more organs. It could be just your bladder, it could be the rectum. So it may be that you just feel pressure in that vaginal area to the point where it can be so severe that you actually feel something hanging out between your legs. And usually it's one of those things that the woman wakes up one day, she goes to the bathroom, she goes to wipe herself and finds what they think is a mass, and it basically turns out that it's just one of their pelvic organs has kind of slipped out. Prolapse typically is always linked to pelvic floor weakness. The structures that are supposed to hold everything up and in and high and tight are just no longer doing their job. And it's usually because there's a lack of muscle mass or muscle endurance, or very often it's just a result of the person having bad body mechanics. The people who are more at risk are obese people, someone with a family history of prolapse, a woman who has had 3 or more children.
Some of the things that could cause prolapse would be like chronic constipation, chronic bearing down on the pelvic floor, chronic cough, large babies.
Therapy consists of a combination of teaching them how they should move, how they should pick something up, how they should get in and out of the bed, how they should handle their children, what they should be doing when they exercise to make sure they're breathing properly.
The goal with physical therapy and prolapse is to strengthen the muscles to help support the bladder and support the rectum.
So we have to teach them how to breathe, how to lift through the abdominal muscles and pelvic floor muscles.
So it's a lot of education on body mechanics, and then it's a lot of training on pelvic floor strengthening and how to strengthen their pelvic floor. Some people will come to therapy and then still end up needing surgery if they had a severe enough prolapse. The key though is that I always tell people it's kind of like if you're going in for a knee replacement. The trend now is that they find much better outcomes if you go in and you do some therapy to strengthen that area before surgery. Even if someone knows that they have a prolapse that's so severe that it's going to require a surgical fix, they still need to come in and strengthen those pelvic floor structures, because if they don't, over time, that tissue will start to gradually slide down again because they don't have that strong bowl at the bottom.